My name is Monica Kimber, and I'm going to do my article review presentation. My article review presentation is on Clinical Psychopharmacology Made Ridiculously Simple. It's the 8th edition. It's a book that might be appealing to both physicians, mental health practitioners, and anyone who desires to know about psychotropic medication. John Princeton is a psychologist at the Alliant International University, Sacramento, California, and James Johnson is a medical doctor at Kaiser Medical Center, Department of Psychiatry, South Sacramento, California. The book, authored by John Princeton and James Johnson, focuses on psychotropic medication and various mental health disorders. The author argued that successful medical treatment of emotional and mental disorders depends on two factors: a thorough knowledge of psychotropic medication and an accurate diagnosis. The overview of psychopharmacology in children and adolescents. It's a journal written expressly for school psychologists and personal. The authors, Brong and Dingle, they believe that school psychologists is in a very influential position, which is essential to the monitoring of psychological symptoms and the effects of treatment in children. Therefore, the authors argue that it is essential that school personnel understand the appropriate use of psychotropic medication, including the indication, benefits, side effect, and required monitoring. However, both Princeton and James and Brong and Dingle discuss psychopharmacology from two different perspectives. Princeton and James' approach is the medical model approach, and Brong and Dingle, they believe in a more holistic approach. Although they lean more towards the medical model, they believe that practitioners must be sensitive to the cultural factors that influence values, expectations, and norms about psychopathology and medication among various social classes and cultural groups. Princeton and Johnson, they argue in their book, their basic argument is that successful treatment of emotional and mental disorders depend on two factors: a thorough knowledge of psychotropic medication and an accurate diagnosis. However, Brong and Dingle, they did not fully agree with that argument. They believe that having knowledge about the fact of medication is important, but it is also imperative to consider that the field of psychopharmacology carries with it a host of other issues such as patient education, compliance, attitude and beliefs about medication, and the need for adjunctive therapies. Ingersoll and Rack also underscored the importance of an accurate diagnosis because they said that clients do have comorbid disorders. They may have depression and anxiety, and sometimes they may have both. However, he believed that an accurate diagnosis is important, but it is not one of only two factors in an effective treatment, or neither it is one of the two factors that is essential to help improve diagnosis and treatment outcome. However, Princeton and Johnson, they argued for the importance of accurate diagnosis based on the fact that there are 6 different anxiety disorders they have seen together, they have seen in their clinical practice, and therefore they believe that an accurate diagnosis is vital because there is no one treatment appropriate for all the different anxiety disorders. And he further added that the factors in the etiology of some of these mental illness. He stated that there are psychological and physiological factors in the etiology and treatment of many psychiatric disorder, and he stated that in many, if not most mental disorder, it is helpful to think of it as a continuum or a spectrum, which is true. Almost all mental disorders usually represent heterogeneous syndromes. When we talk about depression, for instance, it is important to realize that depression can present in several different ways and may have diverse etiologies. In some instances, the cause may be purely psychological, maybe losing a job, the death of a loved one, or maybe rejection. Likewise, symptoms may be largely psychological in terms of feelings of low self-esteem and sadness. However, his main focus is on the biological side of the disorder. And his focus is mainly on the medical model approach to mental illness. However, in order to offer a client or a patient the highest form of care, treatment should not be based on a professional preference. It should be based on what is best for the client. It is important to know that there are clients who may have their own preferences. Hence the reason well-informed professionals are better able to help their clients make educated decisions by helping them understand their options regarding medication and potential side effects and various treatment options. For example, antidepressant does not cure a disorder. They are only used to ameliorate the symptoms. Ingersoll and Rack also added, based on the medical model approach, for instance, of depression, most people who use different classes of antidepressant, for example, may respond positively to it, but in some cases, patients do not always respond favorable to drugs. So having a thorough knowledge of psychotropic medication and having given an accurate diagnosis is very important. But this is not the only two factors to successful treatment, because clients may not respond. They may have a accurate diagnosis, and the professional will be quite knowledgeable on psychotropic medication, meaning that they will give them the right medication for the diagnosis, but the client may not even respond to the medication. So it is not true that there is only two factors. Ingersoll and Rack believe that medication is time limited. Therefore, treatment should consist of other modalities. Studies have shown that patients who take medication plus psychotherapy have better outcomes. Although many of the symptoms, especially in depression, may be strongly connected to biological components, there are also psychological, cultural, social, and spiritual influence on these diseases. To further add, depression affects the whole person. It includes the body, mood, and thinking. Using an integrative approach to treatment would always be better. A therapist would be able to uncover any psychosocial stressors that may have precipitated with the depression. It could be specific environmental events such as a death, a divorce, a medical problem. If you take medication without having a therapist, there is no way you would understand all of the environmental events that could affect those depression or precipitate the depression. Research has also shown depressed feelings come from negative self-talk, which might be an inaccurate thinking. Using medication alone will not be able to help. the negative self-talk. One might have to use cognitive therapy, or may have to use behavioral intervention, which would be to help increase positive reinforcers. The person may need to learn new skills to increase social interaction and to engage in activities that would help alleviate the mood and feelings of helplessness and hopelessness. There are other factors that influence treatment outcome too. There are factors, non-adherence to treatment, taking low doses. Also, there might be certain foods and beverages that might influence the rate in which the drug is absorbed in the stomach. For a drug to reach its targeted location, which is the central nervous system, to affect its therapeutic properties, it first must enter the stomach and get absorbed by the blood. So certain foods and beverages can hinder this process by their negative interaction with the drug. This can prevent the drug from reaching the brain, the targeted site for the drug to take effect. Many people who are depressed usually smoke. Some drink coffee. The nicotine and the caffeine can also affect the metabolism of the psychotropic medication. Alcohol use can reduce or hinder the effectiveness of the antidepressant. So, although many of the symptoms of depression may be strongly connected to the biological component, there are also psychological, cultural, social, and spiritual influences on this disease. Even though psychotropic medication do not cure mental disorders, it is important to understand which symptoms may respond to talk therapy and which seem to require medication, and which would likely respond to a combination of medication and therapy. Therefore, I do agree with Princeton and Johnson that a thorough knowledge of psychotropic medication and an accurate diagnosis is important. Although clearly these are not the only two factors for successful treatment outcome. However, when patients receive the wrong diagnosis, they also tend to receive the wrong medication as well. This can lead to increased dysfunction by exposing an individual to pharmacological treatment that increase present symptomology or cause the development of new symptoms. Finally, most mental health professionals work with clients taking psychotropic medication. Therefore, I believe a knowledge about the drugs their clients are taking to better able to educate them on the side effects and to make better treatment option is very important. Thank you so much. Thank you.